when enough evidence accumulates, silence ceases to be neutral. As time went on, the data began to pile up uncomfortably. What was once considered an exception started to appear across various contexts, cultures, and medical institutions, always sharing similar characteristics. Reports of preserved consciousness in states where, according to the materialist model, it shouldn't exist became too frequent to dismiss as mere coincidence. Among these pieces of evidence, near-death experiences held a central position. Patients who were clinically deemed unconscious described, upon recovery, complex, organized, and emotionally impactful experiences. They reported a clear awareness of themselves, their surroundings, and, in some cases, events that took place while they were under strict medical supervision. What was most unsettling was not the spiritual content of these accounts, but their coherence and consistency. In various situations, tests indicated a lack of cortical activity consistent with conscious experiences. Nevertheless, the accounts provided verifiable details such as dialogues, medical procedures, and external events unrelated to the patient's body. These elements couldn't easily be attributed to hallucinations, as they involved information that the individual wouldn't have been able to access through traditional senses in that state. Gradually, some researchers began to entertain a previously unthinkable hypothesis. Perhaps the brain doesn't generate consciousness, but rather modulates it. Maybe it acts as a filter, a receiver, or a translator for something more expansive. This idea, while straightforward, carried profound implications and elegantly explained why consciousness might persist even when the brain falters. Science faced a choice. Either expand its framework to accommodate the possibility of a non-local mind, or continue amassing data it couldn't interpret. And when enough evidence accumulates, silence ceases to be neutral. It becomes a form of resistance. The question is no longer whether these phenomena exist, but why they are still not being openly discussed.